Happy Motivational Monday. Hi, it's a nursing professor here. First of all, I want to thank you all for all your well wishes, your positive vibes, your prayer to help me in my road to recovery because I'm feeling much better. Not 100%, but much better. And so with this Motivational Monday, I want to introduce to you a series of 4 where we're going to take the next 4 weeks to discuss alternatives to bedside nursing or acute care nursing. And what's driving me behind this is that the data supports that many nurses are leaving the bedside. Whether or not you're a new nurse, a new grad, a student, or a seasoned nurse, then there are alternatives that are available to you that you can use those clinical skills that you have developed in another setting, and it just might work for you. So today we're going to talk about the appeals nurse. And the appeals nurse is actually a position I've held for about 20 years now. And I actually fell into it by working for an agency covering someone while they were on maternity leave, and they never came back. And so I stayed there. And so there were times when I was PRN, part-time, full-time, and all of those things like that. But it is really a very rewarding position that many people have never heard of. And so what does an appeals nurse do? An appeals nurse is a healthcare professional that actually does research and looks at the medical record to find information to support continued stays for a patient to be inpatient, or maybe why that person should be inpatient versus in observation. But that nurse is the person who is going to be the detective, look through that documentation and determine what an insurance company has decided that should not be paid. We know that the insurance process is this: person has a service, a claim is submitted to the insurance company comes back, they either pay it or they deny it. And more frequently these days, especially with AI, insurance companies are denying claims because they're more computerized process, as opposed to actually a person looking in the chart to determine if there's possibly some contributing factor as to why that person needs to have a continued stay. So my role, or in the role of an appeals nurse, is to find supporting evidence as to why that person should have a continued stay, or maybe go to a subacute unit or an acute unit or something like that. And so education needed. You need to be just a licensed nurse. I mean, you could be a registered nurse or an LPN. That's really about it. You are literally bringing your bedside experience into an office setting. Where do appeals nurses work? They work pretty much remotely these days. I don't know anybody who's actually sitting in a hospital, but I'm sure somebody will tell me that they still do. But the jobs are typically remote. They're typically very, very flexible. They could be in an acute care hospital, mental health hospital, subacute unit even, because the idea behind it is that there has to be a reason why a person remains inpatient anywhere. You just can't be in a hospital these days just because you need to take a rest. Okay? And so that nurse is going to make sure that they uncover that information to support it. Advantages, again, flexibility. You typically have a 40-hour week, which can include weekends. Sometimes people like to work night shift. There is a vast amount of flexibility there for you to be able to get your scheduled hours in. It's also a decent paying job. It's usually a 6-figure income for a full-time appeals nurse. Sometimes with bonuses depending on what your performance is. It's one of the few quantifiable nursing jobs, which means this is that it is very evident how much money you're actually bringing into the facility as a result of your work. And so we know that when we're at the bedside, we're bringing in a lot of money for these facilities because we're the only profession, I've said this 100 times, that is at the bedside with a patient for 24 hours. All right, so you got what an appeals nurse is, you got where we work, you see the advantages of it. And so what I want to say to you is this, is that you can bring that bedside nursing experience that you have, and you'll actually start to treat your patient on paper. And so literally what I do, which brings me a lot of success, is I'm thinking about that patient who's trying to recover from an illness. They're trying to recover from an illness, and they're getting these bill collectors. They're getting all of these, my mom used to call them window pane bills, where you get those medical bills saying that the claim wasn't paid and this is your responsibility. And some of those things can be very, very threatening, especially to a person while they're trying to recover. And so I take my role very seriously in that I don't want that to happen to my patient that I don't even know, but they're on this paper. And so as I work to find information to support their stay, then I'm looking for abnormal vital signs. I'm looking for abnormal labs. I am looking that the person had pain levels that were like 8 out of 10, or they got prescribed new medications and things like that. And so documentation is so important when you're at the bedside. And you might not see the whole picture because, we know we have to document. If we're not documenting, it's not done. But it is so important to the actual payment and collection of revenue that has to happen as a result of that. So I hope that information is helpful. If you have any questions, please drop them down below. Thumbs up, share the video to anyone, and see you next week with Motivational Monday, where we'll talk about another alternative to bedside nursing. Because the truth is this, is that acute care is just incredible. We do super duper jobs at the bedside, but at some point, sometimes life is lifing, and that might it might no longer fit our needs. And as opposed to leaving this career, then having other options might be something that you'll be interested in doing. So I hope that helps. I'll see you next week. Bye for now.